So we're with Dr. Moskowitz at our cardiology mission, and this is like his 100th trip to St. Vincent. I'm joking. So tell me what number we here in terms of trip, and how has this mission been?
I think this is my 16th trip to St. Vincent and the Grenadines. It'll be my 10th trip to St. Lucia, but all total probably 30 trips to the Eastern Caribbean and Central America.
I wasn't too far off.
No. It's always been a pleasure. Depending on the country, we screen children for heart disease. We've started a rheumatic fever, rheumatic heart disease prevention program and surveillance program. So we follow the children if they need medications, but also to instill in them and their families the importance of follow-up, as well as taking the penicillin so they don't get another episode of rheumatic fever that can damage their hearts even more. That's the critical part.
You've been coming here for quite some time, so what is the main thing that you want to say to parents of patients? Because there may be things that you see reoccurring and stuff. What concern you have, and what do you want? How you want them to help you with it?
Well, certainly the children who are born with congenital heart disease, follow-up is important. For some of them, they may need additional procedures because as they grow, the repairs that were done in early childhood don't grow with them, and they may need additional work. The children with rheumatic heart disease, it's again the importance for the parents to be sure that they get their penicillin on a monthly basis or daily to prevent another strep throat, which could damage their heart, and then they may need to have surgery to repair the valves.
What is the best part about your job?
Oh, besides the beach and the beautiful weather, the people, the families, the children, always fantastic.
And what is the most rewarding part about working with WPP?
WPP has the right vision that geography should not determine the healthcare access to a child, and so that being able to provide these critical services to children whose lives are entirely in front of them by being able to repair what they were born with, they have full lives ahead of them, so that being able to offer that and continue to follow the children to maintain their health as good as possible is the best part of it.
There are persons and different institutions that support WPP in terms of funding and sponsorship from time to time. What would you like to say as a physician and a surgeon? What would you like to say to them about their support and how it helps you in your work?
The support cannot be thanked or acknowledged enough because we couldn't do what we do without their support. And by providing that support to the doctors who are skilled and for the people in each country who support their own children, being able to provide these services and see how they grow from young childhood to adulthood to be fully functional citizens of the country, employed, with good education, and living their life to the fullest, that's the best thing.